Hi, welcome to the show. It's been almost a year since the World Health Organization declared COVID-19 a global pandemic. And for much of the year, as you well know, the outlook has been bleak, but there is some light at the end of that proverbial tunnel, and it's getting a bit brighter. On Friday, Health Canada approved the use of a fourth vaccine, this one produced by Janssen, a subsidiary of American healthcare giant Johnson & Johnson. It's the first single-dose vaccine approved in this country, and it comes at a time when more vaccines have been confirmed to come in before the end of March. To talk about all of that and more, from Thunder Bay, Ontario, is Canada's Minister of Health, Patty Hajdu. Nice to see you, Minister.
It's great to see you, even if it's virtual, Rosemary.
Indeed, everything is. I want to start with the approval of the Janssen vaccine because I think there have been a lot of talk about the efficacy rates of different vaccines, and some Canadians are taking in that information and feeling a little bit hesitant about which one is more or less effective. What is your message to Canadians around the efficacy of vaccines?
Well, I think the first thing we need to remember is that they're all effective against death from COVID-19. So the real life science is essentially showing us that regardless of which vaccine people are receiving, that they are preventing death from COVID-19. So take the first vaccine that you're offered. It's really, really important that you get protected from a really terrible case of COVID that could lead to your death. Secondly, more data is coming in as we see these vaccines perform in real world in terms of their effectiveness against protecting against even mild forms of COVID-19. And that's where we're starting to get into those conversations around efficacy. You know, are they preventing all cases of COVID? Are they preventing just the most severe cases of COVID? And that research is still evolving.
We are set to receive 2 million more doses of vaccine by the end of March than we had previously anticipated. How confident is the federal government that the provinces are ready for that? And is there anything you can do to further help them?
Oh, we are working every day, hand in glove with provinces and territories. And of course, everybody's familiar now with Major General Danny Fortin, who is leading the charge, working closely with provinces and territories on their plans, not just for obviously the more complex vaccines that we've seen, Pfizer and Moderna, but also to make sure that they have a really good planning underway for the less complex Johnson & Johnson and AstraZeneca types of vaccines. And they're all working incredibly hard. Listen, I think all leaders right now know the imperative is getting people vaccinated, Rosie. It's so important to every province, territory, and indeed local leader that I think it's really an all hands on deck moment.
Your colleague, Anita Anand, the Minister of Procurement, said on Friday that we are now set, if we get the Johnson & Johnson, to receive up to 118 million doses of vaccine by the end of September. That's obviously more than we need. Is there anything in the contracts with those companies which would prevent us from sharing the vaccine with other countries? Are we going to keep all of those? How is that going to work?
Well, I'm working really closely right now with my colleagues, Minister Gould and Minister Garneau, on our international support for beating back COVID-19, because I think we all know that as long as we have COVID-19 raging out of control in some countries, it puts all countries at risk. And so, of course, our priority is to get Canadians vaccinated as soon as possible. But, you know, we are a major contributor to COVAX. We also have extra doses, and the Prime Minister has been having conversations himself as well with world leaders about how we make sure that anything we don't need gets put back into a process that gets the people most in need around the world.
Okay, but just to that just to be clear, are there things that contractually would prevent us from sharing those extra doses?
I can't answer that question at this point, Rosemary. That might be a better question for Ms. Anand, who has seen those contracts in detail. But I will just say that there is a recognition amongst all of us in the government, all the ministers that are responsible for this file, that when we get to the place where we're confident that Canadians have had access to a vaccine and that we have enough doses to share, our intent is to share those doses with the world.
Okay. As you well know, the National Advisory Committee on Immunization recommended extending the dosing period now up to 4 months. This came as one of Canada's top scientists, Mona Nimir, told my colleague on Power and Politics that this was, quote, an experiment on the population. What do you say about that? Because that obviously would make some people a little bit worried. So what do you say about those comments?
Well, I can't really speak to Mona Niemer's comment, but I can speak to the work of NACI. NACI, as you know, is National Advisory Committee on Immunization, a little long-standing advisory committee to the Government of Canada who provides advice on immunization, by the way, and has for a number of years, not just around COVID, but of course all other immunization. This committee is comprised of experts in virology and immunology, in epidemiology, and these experts have studied the data, both real-world data, clinical data, and made a recommendation based on their deep expertise in the area of immunology and, of course, of the examination of the data as it's unfolding around the world. I'm very comfortable with the advice of NACI. I'm not a scientist myself, Rosemary, but I can tell you that we have phenomenal researchers and scientists, and people can check out NACI's guidelines online. They can read the reports themselves. So it's all very transparent. Canadians can understand why they've come to those conclusions. And certainly I know provinces and territories will use that advice to guide their own next steps on immunization.
As we get into the happier part of this story, vaccinating people, is Canada considering a proof of vaccination before reopening our borders to other people? Because it seems like that would be the natural thing to do, but I don't know how controversial it would be.
It's challenging right now to understand what vaccination confers in terms of onward transmission. We know it does save lives. This is why I say take the first vaccine that's offered to you, because it will protect you from dying of COVID-19. But the question that is still sort of remaining in terms of how researchers are analyzing is, what does it mean around onward transmission? If you still contract a mild form of COVID, are you just as infectious as you were if you weren't vaccinated? And those questions continue to evolve as the research does. But I'll also say that the issue of vaccination certification is a very live one right now. It's being discussed around the world. I'm a member of the G7 Health Ministers. We meet every couple weeks. This has been on our agenda. And of course, my colleague, Minister Omar Habra, is working with the International Association of Transportation. And those, I think I might have said that wrong, but IATA, the folks that organize transportation internationally, that work is happening. And I will say right now, it's very, very, it's a dynamic space is the probably best way to say it, because of course the world are grappling with the same questions Canada is.
Sure. Would it have to be a coordinated action though? Is that, given that you're discussing it at those levels?
I think the intent is to coordinate, yes, because you can imagine the confusion in international travel if there's different certifications that are required. I mean, we've kind of come up against this with testing, right? The pre-departure tests, really, we had to sort out, well, which labs are acceptable and what kinds of tests are acceptable, and how do we ensure that the test is verified and it's not fraudulent? And so all of these questions remain the same for vaccination certification. So that's the real challenge, is trying to come up with something that's coordinated. I think every country in the world wants to see international travel resume at some point in a way that's smooth and efficient and allows for some cohesion.
Okay, two other quick questions, and they are sort of looking back questions. At this time last year, when you were asked about closing the borders of this country, you said the following, quote, "The long-term implications of shutting borders down is they're not very effective in controlling disease. In fact, they're not effective at all." Of course, in fact, we have closed the border to all non-essential travel, and we've increased restrictions dramatically. Do you think that you were too unwavering in your position around the border?
I certainly think, listen, the root of those statements came from the international health regulations, which, by the way, still exist and still indicate that border measures are not all that efficient at stopping transmission of viruses. But when I look back, are there things that I said that clearly, obviously evolved in a different direction? Absolutely. And I think one of the things that I think the pandemic has taught me is that when you have an incident of such significance globally like this, even previous existing research and regulations may not be appropriate. I think Dr. Tam says, you've seen one pandemic, you've seen one pandemic. She says this to me all the time. And I think, when I look back as a new health minister, following the advice of my department, of course, there are many things I think, I could have done differently. The other piece to this, Rosemary, that's interesting is the story's not done yet. The research will be done for decades. I just hope I'm alive when we get the full analysis of what worked well and what didn't globally around around COVID-19 pandemic response.
I'll just ask you quickly in 30 seconds. You know, people are tired. People are really tired and fed up. I'm sure you are too, to some extent. What would you say to people right now thinking about the year that was and what is still to come?
Oh, I feel that fatigue. I'm in Thunder Bay, as you know, which is surging, one of the highest rates of growth right now of COVID-19 in Ontario for sure, probably the country. And so people are tired. People are lonely. People are struggling. I would say let's keep going. I know it's really, really hard. And I want to thank people for the heroic sacrifices they've made. And there are ones that we know and ones that will never be able to understand the full impact. But there is, you mentioned at the beginning, there is a light at the end of the tunnel. We do have effective vaccines, more and more arriving. More people are getting vaccinated earlier than we thought possible. Many provinces and territories are accelerating their vaccination plans. So there is relief, and those vaccines are going to save lives. So please take your vaccine when it's your turn.
Okay. Minister Hajdu, thank you for getting up early for us this morning. Appreciate it.
Thanks very much, Rosemary. Great to see you.
You too. That is the Minister of Health, Patty Hajdu.